Para for dictation, 5 seconds to start. Exercise number 4. 5, 4, 3, 2, 1. Alcohol consumption, even in small amounts, significantly increases the risk of buccal mucosa cancer (BMC), a common and aggressive form of oral cancer in India. According to a large multi-center study published in BMJ Global Health, full point. The study analyzed data from 1803 men diagnosed with buccal mucosa cancer and 1903 cancer-free controls recruited from 6 cancer centers across India between 2010 and 2021. Full point. Researchers assessed the impact of both internationally recognized liquors and locally brewed alcohols. Full point. The analysis was restricted to men as very few women in the study reported alcohol consumption, limiting reliable risk estimates among females. Full point. After adjusting for tobacco use and other confounding factors, men who had ever consumed alcohol had a 68% higher risk of developing buccal mucosa cancer compared with non drinkers. Full point. Importantly, even alcohol intake below 9 grams per day, less than one standard drink, was also associated with a significantly increased risk. Full point. Locally brewed liquors showed particularly elevated risks. Full point. Ever users of country liquor had nearly double the risk of buccal mucosa cancer compared with non-drinkers, with Tharra and Desi Daru emerging as the highest risk beverages. Full point. Beer and whiskey were also consistently associated with increased risk, even at lower levels of intake. The study found a strong interaction between alcohol and tobacco use, especially smokeless tobacco. Full point. Men who consumed alcohol and chewed tobacco faced substantially higher risks than those exposed to either factor alone. Researchers estimate that more than 60% of buccal mucosa cancer cases in the study could be attributed to the combined use of alcohol and chewing tobacco. Full point. At the population level, alcohol consumption alone accounted for an estimated 11.3% of buccal mucosa cancer cases in India, with wide variation across states. Full point. Buccal mucosa cancer is the most common form of oral cancer in India and has a poor 5 years survival rate of about 43%. The study highlights that a substantial proportion of cases occurred in men below 45 years of age, pointing to early exposure and long term health consequences. The findings challenge the perception that low or moderate drinking is safe. The authors call for integrated prevention strategies addressing alcohol and tobacco together and for stronger regulation of locally brewed liquors, which often fall outside formal licensing and quality control systems. Global warming is pushing butterflies towards higher elevations, yet their caterpillars can only survive where the right host plants grow. Full point.